Hello, my name is Robert Holbach. I work in the University of Passau on the project Internationalization 2.0. Today I'm going to produce this video to show you how to register for a COVID-19 vaccination in Bavaria in Germany. So if you are one of the international students or researchers currently visiting the University of Passau, and if you are not entirely sure what some of the options in the registration process mean, this video may help you. Please keep in mind, I'm not a legal or medical expert, so this video and the translation I'm providing is entirely for advisory purposes. You're probably going to have to talk to your accommodation provider, your employer, or your doctor to obtain letters if any of the priority categories apply to you. So at that stage, you may want to get more detailed advice and to check whether any of the information that you use is correct. I am going to be putting the time codes and the web addresses in the description of the video so that you can skip to the correct section of the video and so you can follow the websites. Please also keep in mind the situation changes rapidly and this video was recorded on 4th March 2021. Now, first of all, quick word on the background. The COVID vaccines are administered according to a prioritization scheme. So the Federal Health Ministry in Germany produces a list of priorities for who should be vaccinated in which order. And we're going to have a look at the Federal Health Ministry website now. There you will find the frequently asked questions about COVID vaccinations. Specifically, the page you're looking for is called Fragen und Antworten zur COVID-19-Impfung. We recommend you don't switch to the English version of the page, the reason being that the English version takes you to information for tourists, whereas the German page is for residents, and if you are staying in Germany to study or work here, you need the information that applies to residents. The question that is likely to be most relevant to you at this stage is, wer wird zuerst geimpft? Which is basically who is going to be vaccinated first. If you open that question, you will find that there are 3 priority groups listed, with an unspoken 4th priority group, which is everyone else who doesn't fit into any of the 3 categories listed first. Höchste Priorität means highest priority. Hohe Priorität means high priority, and erhöhte Priorität means increased priority compared to the general populace. Höchste Priorität includes everyone aged over 80, as well as people working in different sectors who are likely to be exposed to the virus or with particular health conditions that make them particularly vulnerable to the virus. I'm not going to talk you through all the options here, but I will talk you through all the options in the form when you register for the vaccine waiting list. Hohe Priorität means high priority. And this is the group currently in March 2021 being vaccinated in Bavaria. It's everyone over the age of 70 and a long list of people who have certain health conditions or certain living situations that mean they need to be high priority for getting vaccinated. And increased priority, erhöhte Priorität, will list another set of circumstances or medical conditions where people are considered to be at higher risk of having a serious case of COVID-19 if they catch the illness. So once again, you see there's a long list of categories of people whom this priority applies to. I recommend you have a look at these FAQ together with a friend or using translation software so that you understand what the recommendations and priority groups are and everything else to do with vaccination. Once you understand everything, if you live in Bavaria, you're going to have to use the vaccination registration web portal. So that's this website. The address is impfzentren.bayern/citizen and the web address is in the description of the video. I should mention it is also possible to register for the waiting list via phone hotlines. To look these up, visit your local council's website. However, the centralized vaccine portal works across Bavaria and might be the easiest solution. On this page you'll find two buttons, Registrierung starten and Ich habe bereits einen Account. The button Registrierung starten means commence registering, and the second button Ich habe bereits einen Account means I've already got an account, and it is the button for you if you want to amend an existing registration or add family members or people you are responsible for. So the first time you use it, you're going to have to use the blue Registrierung starten button. This will take you to a place where you enter an email address and choose a password. And I'm not going to show this email confirmation process, but basically you enter an email address, you receive an email almost instantaneously, and you click on a link to commence entering information into the registration form. And you arrive at this page. Wichtig zu beachten means this is an alert, and it tells you, die folgenden Angaben zu Ihrer Person, Alter, Ihrer beruflichen und wohnlichen Situation und zu Ihrem Gesundheitszustand werden bei der Priorisierung berücksichtigt. Meaning, the information you're about to enter, everything about your person, including your age, your employment situation, your accommodation situation, and your health conditions will affect your priority in the vaccine waiting list. And the box you're going to have to tick says, ja, ich habe zur Kenntnis genommen, dass ich zu allen Angaben einen Nachweis, zum Beispiel Lichtbildausweis, Nachweis des Arbeitgebers oder Nachweis der Risikofaktoren und Vorerkrankungen zum Impftermin im Impfzentrum vorweisen muss. This text says, yes, I understand that every information I choose and enter, I am going to have to provide evidence for. So you're going to have to prove your identity with an ID card or a passport. If you select any of the employment-related options, you're going to have to bring a letter from your employer. And if you select any of the health conditions, you're going to have to bring a doctor's note when you turn up to the appointment for a vaccination. Without these, you will not be vaccinated. For that reason, you may even find it quite helpful, if any of the health risk factors apply to you, to fill in this form together with a doctor or ask them for advice about it and get the note at the same time so that you can use it later on. Bestätigen means confirm. So by ticking the box and then clicking bestätigen, you confirm that you're going to have this evidence by the time you get an appointment and you're going to bring it to the appointment with you. After you've confirmed this, you're going to have to enter your basic personal details. Vorname means first name, Nachname, last name, Geburtsdatum is your date of birth in the format day, month, year. Your Geschlecht is your sex, weiblich means female, männlich male, diverse means non-binary. Then your address, your postcode, the town where you live or village where you live, and the Landkreis, which is the council area. And the local council area, the Landkreis, tends to be filled in automatically once you've entered your postcode. Following this, the next options are about your employment or living situation. So the first option means Ich arbeite in einer Pflege- oder medizinischen Einrichtung means I work in a care facility or a medical facility. Nicht zutreffend means not applicable, so no, you don't work in a care facility or a medical facility. If you don't work in a medical or care facility, look in the description for the time code and skip to the next question. If you do work in a facility that provides care or healthcare, then I'm going to go through the options that you can select from now. And as you can see, there are quite a few options. The first option is medizinische Einrichtung mit sehr hohem Expositionsrisiko. Covid-Station, Notaufnahme, Intensivstation, Ambulanz, in der Bronchoskopie oder ähnliche aerosolgenerierende Tätigkeiten. That means a medical facility where there is a very high risk of exposure to the virus, such as COVID stations, accident and emergency units, intensive care units, ambulances, or any facility where tests are conducted where patients produce a lot of aerosols, such as the bronchoscopy tests. The next option is medizinische Einrichtung mit besonders gefährdeten Gruppen, Onkologie, Transplantationsmedizin und Dialyseeinrichtungen. That means you work in a medical facility where you work with people who are at very high risk. Such medical facilities such as oncology departments, transplantation medicine departments, and dialysis care facilities. The third option means, I'll read it out. Medizinische Einrichtung mit regelmäßigem Patientenkontakt, sonstige stationäre Versorgungsbereiche inklusive Maßregelvollzug, means a medical facility where you are regularly in contact with patients, specifically stationary medical facilities, so facilities where people stay overnight. This means, for example, hospitals. And Maßregelvollzug are asylums for people who have been sent into care by the judiciary system. So for hospitals or any other similar facility, if you have regular contact with patients, that is the option. Following this, the next option says Krankenhaus, IT, Technik, Verwaltung, unregelmäßiger Patientenkontakt. So Krankenhaus means hospital, but you should only tick this box if you do not have regular contact with patients. And the examples given are IT, so information technology staff, technicians, administrators, or any other role that does not involve frequent or regular contact with medical patients. So the two options, keep in mind, if you have lots of contact with patients, it would be medizinische Einrichtung mit regelmäßigem Patientenkontakt. If you have little or no contact with patients, the second option applies, Krankenhaus. So the fifth option is Alten- und Pflegeheim sowie ambulant betreute Wohngruppen für ältere pflegebedürftige Menschen. This is a senior citizens or care home or any other assisted living facility for older people or people who need care. Infektionspraxis means a doctor's office that specializes or deals especially with people who have caught an illness or infection. So people who are sent there because they are infected with something. Hausärztliche oder pädiatrische Arztpraxis oder KV-Notdienst means general practitioners' doctor's offices or pediatric doctor's offices or the emergency doctor's offices provided by German statutory healthcare providers. The option below that, zahnärztliche, HNO, ophthalmologische, endoskopierende Praxis, means dentists' offices, ear, nose and throat doctors' offices, eye doctors' offices, so eyes, ophthalmology, or endoscopy doctors' offices. The next option, sonstige Facharztpraxis mit Patientenkontakt, means any other specialist doctor's office where your role involves contact with patients. SARS-CoV Impfzentren oder mobiles Impfteam means you work in a vaccination clinic or in a mobile vaccination team that goes out into the community to deliver the vaccines. Palliativmedizin means palliative care facilities. Blut- und Plasmaspendedienst mit Patientenkontakt means blood donation clinics with contact with patients. SARS-CoV-2 Testzentrum means SARS-CoV-2 Test Center facility. ÖGD-Personal mit Patientenkontakt means public health service staff who have contact with patients, and ÖGD-Personal ohne Patientenkontakt means public health service staff who do not have contact with medical patients. The next option is sonstige Heilberufe, Krankengymnastik, Hebamme etc. mit Patientenkontakt, Praxen von Heilmittelerbringern, other healthcare professionals who have contact with patients, such as physiotherapists or midwives or midwifery specialists, or any other clinic that is registered with the health ministry and so on. Stationäre Behinderteneinrichtung mit medizinisch-pflegerischem Schwerpunkt means a care facility for people with disabilities, where the facility has a medical or care focus, and it is for people who live there. So stationär means people stay there overnight. Ambulante Behinderteneinrichtung mit medizinischem pflegerischem Schwerpunkt means a care provision facility for people with disabilities with a medical or care focus, but it's ambulant, so the people don't stay overnight, or the facility itself might be mobile. Ambulanter Pflegedienst means providers of care in the community, care in your home, mobile care providers. Rettungsdienst hauptamtlich is rescue services professional, and Rettungsdienst ehrenamtlich is rescue services on a voluntary basis. And finally, Unterstützungskraft gemäß Paragraph 45a SGB XI means support worker according to the law, paragraph 45a of the SGB book and chapter XI. So if you're not sure whether you're a support worker under that particular law, talk to your employer to find out. The next option is Ich arbeite in einer Schule oder Kindergarten. I work in a school or childcare facility. Nicht zutreffend again means no, you don't. And if you do work in any educational institution, here is the list. Kindergarten, Krippe, and Kindertagespflege means child daycare facility, usually for younger children. Grundschule, Sonderschule oder Förderschule means primary school, special school, or support school. Sonstige Schule, Mittelschule, Gymnasium etc., die nicht Grundschule, Sonderschule oder Förderschule ist, means any other type of school that isn't a primary school, special school, or support school. For example, Mittelschule or Gymnasium, which is like comprehensive schools and grammar schools in British terms, or high schools in American terms. So secondary education schools in particular fall into this category. The next option is Hochschule, which means higher education institution, such as universities or universities of applied sciences. So if you work for the University of Passau and you're employed here, you can tick that box. The next option is Kinderhort, which is another type of daycare facility, usually for slightly older children. Mittagsbetreuung is lunchtime supervision for children. So if you provide daycare for children over lunchtime, that's Mittagsbetreuung. And finally, Einrichtung der Kinder- und Jugendhilfe means facilities provided by children and youth services departments. The next option is Ich arbeite in Einrichtungen zur Aufrechterhaltung des öffentlichen Lebens, which means I work in a facility that keeps public life going or that keeps the nation running. These are also sometimes called systemrelevante jobs, so system-relevant jobs. Nicht zutreffend again means not applicable. If, however, you do work in a facility that keeps society functioning, these are the options. So the first option is Polizei und Ordnungskräfte im Außendienst, which means police and security services staff who have contact with the public. So im Außendienst, they work outside the central offices. Berufsfeuerwehr means professional firefighting services. Freiwillige Feuerwehr means volunteer or voluntary firefighting services. Energie- und Wasserversorgung means energy and water supply companies. Lebensmitteleinzelhandel means grocery shops and food shops. ÖPNV, Transport- und Verkehrswesen, ÖPNV stands for öffentliche Personennahverkehr, means you work in public transport. Abfallwirtschaft oder Abwasserentsorgung means you work in waste disposal, recycling facilities or in sewage works. THW, Katastrophenschutz, means technisches Hilfswerk, so disaster relief efforts, particularly through the Technisches Hilfswerk organization. Medizinische Einrichtung ohne direkten Patientenkontakt, zum Beispiel Labore, means you work in a medical facility that does not have contact with patients, such as medical laboratories. Verfassungsorgane, Regierung, Verwaltung, Justiz means the government and the judiciary system. and general public office and public administration. Polizei, Zoll, Bundeswehr means police, customs, or the German armed forces. Apothekenwesen, Pharmawirtschaft oder Medizinproduktberatung means you work in a pharmacy, the pharmaceutical industry, or medical advice-giving services. Informationstechnik oder Telekommunikationswesen means information technology or telecommunications companies. Ernährungswirtschaft means food production companies, so agricultural businesses, farms might be that. Bestattungswesen means funeral care providers. And the next option, in leitender bzw. besonders relevante Position in einer der oben genannten Tätigkeiten, means you work in any of the above options in a particularly leading or relevant or high-ranking role. So if you're particularly important to keep your sector running and it's one of the above, that's the option for you. The next option is, ich habe eine besondere Kontaktsituation, which means I have a specific situation with regards to contacts. So nicht zutreffend is not applicable. But the first option is beschäftigt im Einzelhandel. I work in a shop. Beschäftigt in der Gastronomie means I work in a restaurant or any other place where food and drinks are served. Eine der zwei engen Kontaktpersonen einer Schwangeren means you're one of the two closest contacts of a pregnant woman. So you probably look after her to a certain extent and you have frequent contact with her. The next option is eine der zwei engen Kontaktpersonen einer pflegedürftigen Person, die nicht in einer Einrichtung wohnt und mit höchster oder hoher Prioritätsstufe gemäß Corona-Impfverordnung geimpft werden soll. This option is closely related to the following one. Eine der zwei engen Kontaktpersonen einer pflegedürftigen Person, die nicht in einer Einrichtung wohnt und mit erhöhter Prioritätsstufe gemäß Corona-Impfverordnung geimpft werden soll. So these two options. The first one says, I'm one of the two closest contacts of a person who needs care, but who does not live in a care facility and who has a high or highest level priority for being vaccinated according to the Corona-Impfverordnung, the Corona vaccination policy. And the second is the same thing, but you're one of the two closest contacts of a person who has increased priority according to the Corona-Impfverordnung. So both options apply to you, one of the options applies to you if you're one of the two closest contacts, probably a carer, of a person who needs care but doesn't live in a care facility, and they either have highest or high priority in the first option for being vaccinated, or in the second option, they have increased priority. So, the next option is, ich wohne oder arbeite in einer Gemeinschaftseinrichtung. I work or live in a shared facility. Nicht zutreffend, again, means not applicable. But if you do live in a shared facility or you work there, then these are the options that are listed. Schwierige Arbeits- oder Lebensbedingungen, zum Beispiel Langzeitarbeitslosigkeit. If you are in difficult life situations or employment situations, such as being long-term unemployed and you're living in a shared living facility as a result, this is an option that applies to you. Betreute Wohneinrichtung means a shared living facility where there are support staff available. I do not know whether this applies to student accommodation at this point. You may want to talk to the Studentenwerk to find out. Asylbewerberunterkunft means accommodation for refugees and asylum seekers. Obdachlosenunterkunft means accommodation for homeless people. Justizvollzugsanstalt basically means a jail or a prison or any other facility where people are sent by the judiciary system. Stationäre Behinderteneinrichtung is a care home for people with disabilities where the care home is their actual accommodation and they live there. Ambulante Behinderteneinrichtung is a care facility or care provider for people with disabilities where clients don't live there permanently and just visit. Unterkunft Saisonarbeitskräfte is accommodation for seasonal workers, such as agricultural workers working in harvesting and so on. Finally, Senioren- und Altenpflegeheim und ambulant betreute Wohngruppen für ältere pflegebedürftige Menschen. The final option means you live or work in a senior citizens care home or an assisted living facility for older people who need care. Finally, the form asks you for your mobile telephone number. In the drop-down, there's the country code, and Rufnummer Mobil is the mobile phone number itself. The other two things are your landline if you have one and you want to enter them. This finishes the first page of the form, which is all about your living situation and your employment. The next page is all about your health conditions. So again, there is an alert. This alert: Gesundheitsdaten werden nicht hinterlegt. Die nachfolgenden Gesundheitsdaten werden aus datenschutzrechtlichen Gründen nicht gespeichert, sind aber für die Priorisierung relevant und müssen daher jedes Mal erfasst werden, wenn dieses Formular aufgerufen wird. This means the information you enter about your health and your health conditions aren't saved in the web form. So they are transmitted to the vaccination clinic, but they're not saved online. And every time you revisit this form to make any changes or amendments, you're going to have to select each of the options again and re-enter all the information. And this is to do with data protection procedures. So bestätigen means you confirm that you understand that your health information won't be retained in the web form itself. It'll be transmitted but not be recalled here. Now, the first option, liegt einer der folgenden Risikofaktoren vor, asks you, does any of the following risk factors apply to you? And again, nicht zutreffend means not applicable. So if you have any health condition that increases your risk if you catch COVID-19, then you'll have to select from the list. And you may want to talk to a doctor when filling in this part of the form. Trisomie 21 means Down syndrome. Demenz oder geistige Behinderung means dementia or a intellectual disability. Zustand nach Organtransplantation means you have had an organ transplant. Adipositas BMI über 30 means obesity with a body mass index that is larger than 30. Adipositas BMI über 40 means obesity with a body mass index that is larger than 40. Look up online how to work out your body mass index if you are in any doubt. Sehr hohes oder hohes Risiko für schwerwiegenden Covid-19-Verlauf gemäß ärztlichem Attest der Bayerischen Impfkommission means you have a doctor's note from the Bavarian Vaccination Commission that says you have very high or high risk for having a serious case if you catch COVID-19. This is not a general doctor's note, it has to be a doctor's note from the Bavarian Vaccination Commission. Erhöhtes Risiko für schwerwiegenden Covid-19-Verlauf gemäß ärztlichem Attest der Bayerischen Impfkommission means you have an increased risk of suffering a severe case if you catch COVID-19, according to a doctor's note provided by the Bavarian Vaccination Commission. So for increased risk, it's this option. For high or very high risk, it's the previous option. And the doctor's notes do have to come from the Bavarian Vaccination Commission. The next option, chronische Nierenerkrankung, means chronic kidney disease. Leberzirrhose oder andere chronische Lebererkrankung means cirrhosis of the liver or another type of chronic liver disease. Herzinsuffizienz, Arrhythmie, Vorhofflimmern oder koronare Herzkrankheit oder arterieller Hypotonie, Bluthochdruck, means heart disease, heart conditions, or high blood pressure. So if you have any of those, talk to your doctor and you can probably tick that box. Cerebrovaskuläre Erkrankung, Schlaganfall, andere neurologische Erkrankungen means if you have suffered a stroke or a serious condition that is neurological or affecting the blood vessels in your brain, then you can tick this box. Asthma bronchiale means asthma. Immundefizienz oder HIV-Infektion, if you suffer from any immune deficiency condition, or if you are HIV positive, you can tick this box. Autoimmunerkrankungen oder rheumatologische Erkrankungen, if you suffer from an autoimmune disorder or a rheumatological disorder, then you can tick this box. Psychiatrische Erkrankung, insbesondere bipolare Störung, Schizophrenie oder schwere Depression, means if you have a mental health condition such as bipolar disorder, schizophrenia, or serious depression, you can tick this box. Krebserkrankungen inklusive malignen hämatologischen Erkrankungen, zum Beispiel Leukämien, maligne Lymphome, nicht in Remission. If you have cancer or a malignant hematological disease such as leukemia or a malignant lymphoma and your condition is not in remission, you can tick this box. The next two options are related. Krebserkrankungen inklusive malignen hämatologischen Erkrankungen, zum Beispiel Leukämien, maligne Lymphome in Remission weniger als 5 Jahre, means if you have cancer or a malignant hematological disease such as leukemia or a malignant lymphoma which has been in remission for less time than 5 years. And finally, Krebserkrankungen inklusive hämatologische Erkrankungen, zum Beispiel Leukämien, maligne Lymphomen in Remission mehr als 5 Jahre, nicht dazu gehören mit Personen mit geheilten Krebserkrankungen nach Ende der Heilungsbewährung, means people who have suffered cancer, including malignant hematological diseases such as leukemia or malignant lymphoma, which has been in remission for more than 5 years. However, it's not cured completely, it's still there. Then you can tick that box. However, please check with a doctor because this definition is very specific, and as I said at the start, I'm not a medical professional. So geheilten Krebserkrankungen nach Ende der Heilungsbewährung essentially means cured cases of cancer after a certain period of proof has passed. So my translation is really very advisory at this point, and the doctor needs to advise you. Schwere chronische Lungenerkrankung, zum Beispiel interstitielle Lungenerkrankung, COPD, Mukoviszidose oder ähnlich schwere Lungenerkrankung, means if you suffer from severe chronic lung disease, such as interstitial lung disease, COPD, cystic fibrosis, or a similarly severe lung disease, then you can tick that box. Diabetes mellitus, Zuckerkrankheit mit erhöhtem HbA1c-Wert, mit HbA1c größer gleich 58 Millimol pro Mol, beziehungsweise größer gleich 7,5%. If you have diabetes and your HbA1c value is above normal, specifically if it is above 58 millimoles per mol or above or equal to 7.5%, then you can tick this box. Diabetes mellitus, Zuckerkrankheit mit gut eingestelltem HbA1c-Wert, mit HbA1c kleiner 58 Millimol pro Mol bzw. kleiner 7,5%. If you have diabetes but your HbA1c value is well regulated and it is lower than 58 millimoles per mol or lower than 7.5%, then you can pick this box. Finally, chronisch entzündliche Darmerkrankung, zum Beispiel Colitis ulcerosa oder Morbus Crohn. If you suffer from a chronic inflammatory disease of the bowels, such as ulcerative colitis or Crohn's disease, then you can tick this box. After you have selected all your medical conditions, if any, the next option is, liegt eine labordiagnostisch bestätigte COVID-19 Erkrankung vor? Are you currently infected with COVID-19 and has this been confirmed by a laboratory? Die Options are Nein, Ja and Ja, aber Empfehlung Facharzt oder Arztpraxis liegt vor. No, Yes, or Yes, but there is a doctor's note from your specialist doctor. These options are there because if you are currently suffering from COVID-19, the vaccine may not provide any value at this time. However, if a doctor says you should be vaccinated anyway, you can tick that box. And the next option is Besteht zurzeit eine Schwangerschaft oder wird gestillt, which asks, are you currently pregnant or breastfeeding? With the same options, Nein, Ja, and Ja, aber Empfehlung liegt vor, no, yes, or yes with the doctor's note. And the reason for that is that pregnant women and breastfeeding women are not currently vaccinated because the research into the vaccine hasn't been taken to that stage yet where pregnant women would be vaccinated. But if a doctor recommends that they should be vaccinated anyway, they can tick that box. The next option you can choose is Einverständnis zur wissenschaftlichen Weiterverarbeitung. The text says, ich bin damit einverstanden, dass meine Kontaktdaten, Vorname, Nachname, Adresse, Telefonnummer, E-Mail zum Zwecke der Kontaktaufnahme an Forschungsstellen für Forschungstätigkeiten im öffentlichen Interesse weitergegeben werden, etc., etc. This is an optional choice where you agree that your contact details, your name, address, telephone number, and email could be passed on for research purposes and for research that is serving the public, the greater good. It is optional. Whether you select it or not, it does not affect your prioritization in the vaccination queue. So you can simply decide whether or not you agree that your details might be passed on. And the two buttons are Zurück, Back, and Abschließen, Finish. So the blue button Abschließen finishes your registration for the COVID-19 waiting list. Finally, if you do get, or when you do get an appointment for vaccination, you'll get further information about the different vaccines. So we included a link in the description where you can find information in many languages about the vaccines currently being administered in Germany and Bavaria. And it is worth reading, especially if you have any concerns or you want to know more. At the very last, it remains for me to say, stay healthy and good luck.